Welcome to The Explainer. Today we're digging into a really fascinating survey about the future of the UK's National Health Service. And what it reveals is a pretty surprising divide, right at the heart of its big digital transformation plan.
All right, let's just dive right in with a question that really gets to the heart of the challenge here. We're talking about one of the biggest healthcare systems on the planet. So get this, a recent survey found that a full 50%, that's half of the next generation of digital leaders in the NHS, they just aren't optimistic about the ambitious 10-year tech plan. The report actually calls it an optimism gap.
Now that number isn't just a statistic, right? It's a huge signal. So why does this gap even exist? Well, to understand it, we've got to look at what everyone agrees on, and then, where all the frustrations are.
Okay, so first, let's talk about the vision versus the reality. We'll start with the shared hopes and, well, the hurdles that keep getting in the way. And believe it or not, there's actually a lot of agreement on what a modern digital NHS should look like.
And what's really interesting is just how much everyone agrees on the big picture. You've got leaders from all levels saying success comes down to a few key things: improving digital skills for both staff and patients, making the NHS app into a real digital front door, using AI and automation to make things more efficient, and this is a big one, making sure all the different computer systems can actually talk to each other. Oh, and designing services with the people who actually use them. So the vision is crystal clear.
But despite having this really clear vision, leaders are just hitting a wall of deep, structural barriers. And this is where things get really interesting, because the survey was, brutally honest about what those barriers are.
Okay, first up, there's a massive talent crisis. This quote just says it all. Agenda for change doesn't work. A project manager can be paid anywhere from band 5 to 8B. How are you supposed to attract and keep the best people when the pay structures are all over the place? It makes building a skilled, stable team, it's almost impossible.
Then there's this crisis of recognition. Listen to this. Why is DDAT still bundled inside admin and clerical in 2025? It's a great question. You've got these crucial digital, data, and tech professionals, and they feel like they're not even seen as a strategic part of the team. Lumping them in with admin and clerical just completely undermines their influence.
And this just nails the frustration with bureaucracy. More and more layers of decision, or indecision. We all know digital moves at lightning speed, right? But the NHS structure, it just doesn't. You get this decision paralysis, where even when everyone knows what to do, progress just grinds to a halt.
So all these barriers, they affect everyone, but they seem to be fueling a huge difference in perspective between the established leaders and the up-and-coming ones. And this gets us to the heart of it, a real generational divide.
And this slide is really the core of the whole story. You can see the conflict laid out so clearly. The established leaders, they're focused on strategy and structure. It's a top-down approach. Let's scale up what we know works. But the emerging leaders, they're coming from a totally different place. Their focus is on people, the workforce, the culture. They want a ground-up approach, co-creating solutions. It's a huge difference.
And you can see that emphasis right here. They're demanding real-time data at the point of care, instantly. They want to see AI mainstreamed into how things are done. They're saying digital skills need to be embedded in all training for clinicians and operations folks alike. And this one is key. They want to protect time for staff to actually innovate and experiment. They want every single project to start with the users, the clinicians, the staff, the patients.
Okay, so if that's the diagnosis of the problem, what's the cure? What's the prescription? Well, the report lays out a new way to think about leadership, starting with the skills and structures needed to bridge this gap. And what becomes super clear is that the future digital leader isn't just a manager. They have to be a catalyst for change. It's about empathy, to really understand the challenges on the front line. It's about confidence, to push for bold new ideas. It's about being open to constant change, having the resilience to see it through. And, of course, being able to collaborate and build partnerships across all those traditional boundaries.
But it's not just about who leads. It's also about where they lead from. And the report proposes a whole new structure for this, what it calls a distributed model, where leadership isn't just at the top, it's shared across the whole system.
And you can see how this could work, right? It's pretty brilliant. You have the national level setting the overall strategic vision. Then the regional teams step in to oversee delivery, bridging that gap between policy and reality. Down at the neighborhood level, that's where you tackle digital inclusion, because those teams really understand their local communities. And finally, the actual solution delivery happens with provider partners, because they're closest to the clinical action. It's all about putting the right responsibility in the right place.
Okay, so the plan for this new kind of leadership is clear. But the report is also super clear that none of this will work without some really bold actions to smash through those old barriers we were just talking about. And we are not talking about small tweaks here. This is a real prescription for progress. It means mandating that all systems can share data, period. It means radically streamlining governance, cutting through all that red tape. It means investing in user-centered design, so every project starts with the actual user. And look at this one. Create space to fail fast. Allow people to experiment and learn. And finally, empower the frontline. Actually support the staff who are passionate about digital. Ultimately, when you boil everything down, all the data, all the perspectives, the message becomes crystal clear. The biggest challenge here isn't technical at all.
Which leaves us with the final and most crucial question. The plan for a digital NHS already exists, but does the culture to actually support it exist? Because building the future of healthcare, it isn't just about installing new software. It's about upgrading the entire culture. And to do that, you have to bridge this gap between the leaders of today and the visionaries of tomorrow.